Start. Now, basically, when we are into the actual hands-on in an ART, now this andrology lab or what we call as semenology lab along with an sperm preparation is a part and parcel or the first step towards you when you are actually going to go in for a hands-on modulation of the gametes. Okay? Now, why you will say that the lab setup is more important because we have got to make it a point that whatever gametes we retrieve, they have to be handled carefully. That's very important. We provide them least of trauma because once these gametes are from vivo to vitro, they are under a lot of stress. Handling stress, temperature variation, osmotic stress, and all plays a great part on their viability. Now, we cannot provide them optimal conditions which they were having in vivo into vitro. But what we have got to do is, we have got to see to it that we don't traumatize them to an extent that they are incapable of delivering the result. Correct? So what we term as, we want to enhance their survival rate. Simple. Now many times in embryology advance we have seen embryos arresting at certain stage, embryos going slow, deterioration, degeneration, contamination in cell culture. This is all manifestation of our poor QA/QC, quality control, quality assurance. Now, in a simplified form like in an IUI lab, what is our basic goal? Read the sample, capacitate it, and aim for the maximum survival rate. Correct? Because here, gametes will vary. In a semen sample, the quality of the sample will vary from day to day, morning to evening also. So therefore, usually we always advocate collection in the early morning hours. Because depending upon the stress condition, how the person has reached to the lab to deliver the sample, what sort of a day he had at his workplace. So all that ultimately plays into it. And we got to process what we get. We cannot be selective about it. Because this is our basic target as far as preparation of sperm in an andrology lab is concerned. Now, some people unfortunately always brand it, IUI ka sample hai, kuch bhi kar do na. No, it's not like that. Sample preparation, whether IUI, IVF or ICSI, deserves the same amount of respect. So why we need a lab environment? Important is a good homeostatic environment. The first one. But according to me, this will depend upon, mostly important is the embryologist's contribution, and we have to eliminate certain epigenetic factors. Now, what are epigenetic factors? Epigenetic factors are those conditions which we can't see, which we have not even imagined. But unfortunately, they are really detrimental as far as procreation is concerned. Like I give you for example, air quality. Now if 15 to 20 years back I would have said air quality, nobody would have believed me. But today, none of the conferences are complete without 80% of topics on QA/QC. Whether they do it or not in the lab is a different issue. But in the conferences, you have to highlight the importance of QA/QC. And that is very, very essential. Quality control, quality assurance, and this is achieved by following certain standard operating procedures or what we call it as SOPs. And the simplest epigenetic agents are number one, air quality, where you have got VOCs, COCs, volatile organic compounds, chemical organic contamination, SPM, suspended particulate matter. In that case, even the UV light of the sun, humidity, moisture, all play a detrimental role on the genome as considered. So that's why morphologically all gametes, embryos, sperm look fantastic, but when the genome is compromised, the results are affected. That's why many times we see excellent embryos, excellent proliferation, they lived up to their age, excellent transfer, beautiful endometrial proliferation, atraumatic ET, lovely postluteal support, young lady, no other complication, still why the hell aren't they implanting? Well, in ART, out of every 4 cases, 1 is positive, in a nutshell. But if that repeats for a long time, something is wrong with the lab. And this is where the QA/QC comes in. This is where your selection of the equipments, your handling of the equipments, your handling of the media, and most important, the skill and the dexterity of the embryologist. Because handling of gametes is not everybody's cup of tea. First of all, we have to read the sample properly. We have to follow the basic principles and what happens when any procedure is in more or any procedure is in less. So that's why there are certain steps which have to be perfectly modulated, because what we have to live is to manage the patient's expectations. Now many times when we used to go to the labs, we used to tell them, sir, pregnancy नहीं आती है, तो डॉक्टर बोलते हैं, सर यहाँ पेशेंट तो ये नहीं जानेंगे कि मेरा एम्ब्रियो ये स्टेज पर है, वो बोलता है मेरे को तो बच्चा चाहिए हाथ में, you know that in the enthusiasm we used to say, agree to it, they are right. But we can't explain every modality to every patient. You got my point. So sometimes what we do, we cherry pick certain parameters to our advantage. कह रहे भाई एम्ब्रियोस तो बने थे, आपके एंडोमेट्रियम का रिसेप्टिविटी अच्छा नहीं था, एक काम करो दूसरी बार ट्राई करना. So again the whole situation starts rigmarole. But in the meantime, if we don't recorrect ourselves or resurrect ourselves, we are going to repeat the same things over and over again till such a time that the footfalls to your lab will be literally zero. I am not saying that all samples will give you a pregnancy. No, not like that. But this should not continue for a long time. If any problems are there, they should not be repeated. And if a problem is detected, it has to be rectified. Then only you can set a proper laboratory. You have got to be updated with knowledge. At the same time, don't get carried away, because today when it comes to a lab setup, the people advocating lab setups will come with A to Z of a shopping list, just like a shopping mall. And every goddamn thing would be made told to you important. And that blackmail, agar ye nahi loge to sir, don't blame me if the results don't come. Now you are also handicapped. So obviously you will get into it. And they show us a list of many satisfied, happy customers, half of which don't even exist. Right? So ultimately you get sucked into that black hole and you end up buying things which otherwise would not have even made an iota of difference in your embryology procedure. So I'm not telling you that they are bad. I'm not discouraging you from investing. After all, it's your hard-earned money. But it is my duty when we run our training center. Suppose it's a choice of a media. Today there are lots of medias available, by the tons. Tomorrow if you open up, you're saying, I'm setting up a lab. Believe me, you will get flocks of people sitting in your lobby, media people, disposable people, injection people, all promising you the sun and the moon. The gadgetry people. But once they deliver the stuff, and when we want them, we literally have to hunt for them. Correct? Or maybe, if you disturb them quite often, either you block your number, otherwise, hello, madam, range ke baru baad mein phone karta hu, and that baad mein never comes. So whenever you are setting up, be selective. As time goes by, with your increasing footfalls, you can optimize your laboratory. But don't make your lab a shopping center for all the latest gadgetries. What happens initially, you are on an epitome. You would say first lab. Many labs advocate their things, you know how? The first lab in this area to have this. Whether that equipment is proving to be any successful or not is a different story, but ultimately we get unarmed by it. Like the festive scenes, 30% off, one pay, one free. Concession till 50%, the till is different. It may start from 5% or end to 50%, which is quite less. So please, when you are buying the equipments, be very simple, be selective, and buy the equipments based on the grade of performance peripherally also. Because what happens, new gadgets come. How much they are workable, how many of them have invested into that, how successful is the result, what is the availability of the spare part in case of a sudden repair. Many times imported gadgets come, sir हमारे पास spare part नहीं, हमको तो जापान से मंगाना पड़ेगा, तो तब तक मैं क्या करूँ 3 महीना. You got my point. So these are all important points. Now all this will not depend upon you, say, because we are basically biologists. You all are from the medical field. And basically those who loved medicine and biology, they always hated physics, chemistry, maths. Correct? So when it comes to physics and chemistry, oh shit. Because what is hormone? What is media? It's chemistry. What are microscopes? Physics and light. They will come back with a vengeance. Correct? So this is how we have to progress. So progress surely but steadily. So this is what it is, that success. So now I tell you, none of the thing is 100% sterile. There will be some sort of contamination picked up from any nook and corner. But at least as far as embryology is concerned, certain areas like an incubator or a laminar flow or your bench top, whatever it is, that has to be sterile. So at least that much of sensitivity has to be maintained, because it is the challenge for us to cope up with the existing parameters. Okay? Now therefore what we are doing is we are standardizing our procedure, because what is our goal? Our goal is to make a infertile couple pregnant, period. Or at least at the end of the procedure in an embryology, get a good blastocyst at the end of day 5, morula at the end of day 3, or a lovely sperm recovery post-wash. Correct? Now this you have to modulate in a number of ways, right? From the time the sample is procured, the sample is harvested, the sample is cultured, the sample is inseminated. So these are all a part of your QA/QC. But here in QA/QC, your equipments play a very important role. So today, in embryology, I think embryology hardcore work is very limited. Rest is totally to QA/QC. And the other is led to record keeping and form filling. Now I don't know, because as gynacs you should be knowing about the number of forms at A, B, C, D, E, F, G. I don't know what to fill where. And a slightest flaw in this can lead to a total disaster. Bolega ye barabar nahi hai, your A is looking like B or your C is looking like O. Kal se center seal hoga, khalas, finito, you are done with it. So be very careful for that. So this is what it is. Location, gadgetry, media and disposable. Because why should we be specific? Because this is what we are aiming for, is to maintain the proper DNA integrity of the gametes. Correct? See, a patient doesn't care how much the doctor knows. But a patient wants to know how much the doctor cares. Similarly, the gametes want to know how much you care for that. It is not bothered how much you know, but how much you are caring for it. Means right from the time you collect a semen sample, how you collect it, how you equilibrate it, how you liquefy it, how you process it, how you incubate it, what you use, what sort of disposables, what sort of media, what sort of incubator. When you inseminate it, how you inseminate, how much you inseminate, like in an embryo transfer, how much you load the catheter, how much you push, how much you maintain the pressure, inner catheter, outer catheter, the negotiation tips and tricks, all this plays an important part. So many times the excellent gametes which we retrieve are messed up because of our poor faulty techniques, or because our gadgets have messed them up completely. Okay, so this is what we should aim, because this is retrieval, processing, survival and viable. These are the steps which you should follow it. Or this is what actually should be, bless you, this is what exactly it should be happening in the lab. So it comes with a proper planning. Believe me, today, in Mumbai, I'm sorry, when couples come, just like we go in a hotel and we ask, na zara kamara batana bhaiya, they say, sir, show us your lab. Oh, you don't have this? Then how will I get pregnant? Are? It's not a necessity. You got my point. But the sad part is that they have been fed this nonsense from the person across the street. Oh, this is not this. Oh, this is not that. The atmosphere, I don't like it. There was one people who was asking, sir, TV pe kitna channel hai? I said, sir, aap TV dekhne aaye ho ke treatment karane aaye ho? You know, the sad part is we are also now very dearth of a lack of patience, so we have to bend to all their nuances. But sometimes, you know, this psychology plays an effect. Sometimes they come to a right place, but they're pissed off by some other nuances outside. So if you have read certain blogs by this Dr. Anirudh Malpani, you must be knowing him. He's a very senior gynecologist and infertility. He is mentioning that the first person who plays a very important part in your clinic is who? Your receptionist. The way she talks to the patient, na doctor ne ye kala na, fatak se phone rakh diya, finish. The patient get pissed off on the other side. But if she talks to them properly, politely, motivates them to come to the clinic, literally, and once they come, the ambience of your waiting room, not clustered, change the certain things. Most important is keep the literature in your native language. Don't keep so many altu-faltu sports magazines and all that. Patients are not interested in that. Correct? And make them feel at home, a little comfort zone as possible. And as usual, stick to the timing. That's very important. Because they have come to relieve you. And believe me, today the scenario is such that out of 10 patients who are coming to you, 8 have visited other labs. The chance of a neat patient coming to you straight away is comparatively very less today. They first come, do the retrospect, first information report लेके जाते हैं, फिर दूसरी जगह देखेंगे. I know they are emotionally, financially, physically and mentally stressed out people. So the thing is they will try to level best. So of course whosoever promises them the sun and the moon, they will definitely bend to them. It's human mentality. Even we would have done the same thing had we been on the other side of the table, always. So this is what it is. So when you plan a lab, basically, now this latest what used to be happen, labs used to be held in any goddamn residential areas or residential buildings. The drawing room used to be a pickup room. The kitchen used to be a collection room. जो जगह मिली वहाँ डाल देते थे. But now it is not there. Now they have certified certain areas, certain floor spaces, certain zones, exactly, so that it prevents the patient's trauma, sticks to the ethics, sticks to the cleanliness, and patient's privacy. So this is what exactly is needing, because sometimes pathetic things, they mentally piss off a patient. Now suppose you go to a room, sala kuch pata hi nahi, kahan collection room, kahan pickup room, toilet jahan pani pada hua hai, what is this nonsense going on? And in consulting a patient, you talk big about culture conditions and cleanliness and all that. So even patients are educated today. You cannot just take, see, you can fool everybody sometime. You can fool somebody every time, but you can't fool everybody every time. Right? So this is the reason for it. Fine? So this is what I'm putting, because this is what the infertile couple always faces. This is what you have to just assure them. A good, clean, meticulously planned lab with a good, supportive, receptive staff, a friendly disposition, a smile on the face, anybody to solve your query is the biggest plus point for your lab. Other things are different. So that's why nowadays for every labs, everything is to be under one roof. Your counseling room, your sonography room, your blood collection, semen collection, so it prevents the patient the trauma of visiting here and there and everywhere else. So now, this is not exactly for an IUI, this is for a general ART. Now if it's a general ART, definitely your IUI is a part and parcel of it. Location, prime importance. Believe me, you'll consider it funny, but in European countries, when an IVF lab is set up, it's an individualized building, away from the hubbub of the city, into a semi-rural village-like area because of the cleanliness. And when they construct that building, there is a guarantee taken that for the next 5 years, within a radius of 1.5 kilometers, no construction will come across. And here we build a building, exactly next day we sell a building, we can see the opposite person, what is he doing. And what we do is, we bank upon the comfort zone of the couple. भाई train station के बाद में नज़दीक रखेंगे, patient को आसान रहेगा. But this is exactly the contaminated spaces. Because we are not taking care of the epigenetic factors mostly. And don't think that IUI sperm preparation is a simple thing. No, it's equally complicated. Because they think that sperm to millions hai, thode mar gaye to kya hua? No, no. It's like a massive suicide death. If one thing is wrong for one sperm, the whole sample will be. It's collective group effort. I don't survive and I'll let you survive. It's not like that. Agreed. Egg quality more sensitive because they are less in number. And they are very sensitive thanks to the chromosomal content. Fine. So this is what we should follow. These were the guidelines. Now here we have got now the latest guidelines which I have added. So this is old one as such. Now the ART guidelines are separate. But certain points in guidelines, instead of guiding us, are confusing us, to be very frank about it. So you have to be very selective about it. But this lab design and all is meant for, of course, minimize the risks to the gametes, and at the same time, minimize the trauma to the embryologist. That's very important. Because usually, the pattern of working depends upon, there are very strict guidelines. Like say for example, in an IVF lab, the distance between the incubator and the laminar flow would be as minimal as possible. The embryologist should have just 3 square meters of a space to negotiate. But here we think the bigger the lab, the better it is. So we keep the incubator here, we keep the laminar flow here. So this is not proper planning, or what we can say, instrument localization. This is the general floor plan of any lab which you set. Now around about 800 to 1200 square feet is advised. It's a no entry zone. Today, please take care of the fire safety. That's very, very important. The red mark shows the permanent structures which can't be moved. Interdigitations or what we call it as a vestibular arrangements, like from pickup room to embryologist room to the collection room. So no going out. Scrub area, change area, properly plan out. The reason why I tell you, because this is a generalized space allocation. If you want to set up your lab, this we have pulled up from different guidelines and just come to a conclusion. Now say certain things like reception to suit your, but here, insemination room, andrology lab, don't make it big. The bigger they are, we Indians have a habit. ये भी रखो अंदर, वो भी रखो, जितनी जगह होती है ठूस ठूस के 1-1 स्क्वायर मीटर का अपन इस्तेमाल कर देते हैं. Correct? So this is a general allocation, and ceiling height should be advisable because it will incorporate your gas lines or your electrical lines. Because in a lab, electrical work and plumbing work, they are the most crucial. Now, what your IUI setup should be having all these, what your ICSI setup should be having all this. Correct? So don't make very small cubicles, but telephone booth के आते थे ना पहले, before that, 1 जॉन 1 2 3 4 5 6, वैसा मत करो. There should be some space allotment. Now general area. Simple, basic, tile it. Now for an IUI or andrology lab, this is sufficient, but if I was to go for an IVF laboratory, this was very important, because years ago we used to tile it with marble slabs. It used to give a very aesthetic approach. But later on, marble and all were also found to be embryotoxic because they are calcium carbonate. So daily cleaning with alcohol used to make them chalky, so you used to rub your hand, you get the chalky feeling. And that was dispersing suspended particulate matter in the air. Then came the tiling, placing with aluminum sheets. Then came vitrified tiles, they are good. And last but not the least is the modular lab. Logic is to prevent a clean working environment for the cell survival and minimize the trauma by epigenetic agents. Now, when you build or when you construct, very important you have to take care of the building material. Like in an IVF lab, no wood, because wood is organic. You will polish it, you will varnish it, they will give out the VOCs. False ceiling should not be of gypsum or asbestos boards because they absorb moisture. So all these things are to be very much careful about. Stool should be just pure stainless steel, this rotating stool, no cushion. Because many times you have seen a cushion chair is that you bang your head and you have a cloud of dust coming across, however you vacuum them. Flooring should be just plain tiled ones. No linoleum or no carpet because you adhesive, it gives out VOCs. Okay? So building material, extremely important. Clean room. Now basically these clean rooms were like these modular labs. They are costly, but they give a very nice synthetic appeal. They are in panels, but here before we built with a modular lab, you have to be sure that you plan your lab perfectly, because today, if anybody is starting a new lab, I request them to please adhere to the guidelines, because once the things are set up, it will be impossible for you to refabricate your lab. And once the equipments are out, to pack them, shift them, it's a Herculean task. essentials what you need for your simple semen analysis. Like I told you, centrifuge for cryptozoospermia when you are not finding the sperm in the sample in case of severe OAT. In an IUI lab, simple. Don't make it a display of all the latest available gadgets. Magar whatever is there should be of a good quality. I have seen labs, we have a IMSI objective for the ICSI microscope, which costs something like 12 lakhs. But the basic andrology microscope had the 40x missing. Now that's the irony. Correct? So all that glitters is not gold, remember that. And the costlier the gadgets in your lab doesn't mean that the results are a towering success. Or you know, they might be the other way around. I know many of the labs or many of the chains who advertise, first one to have this, first one to have this, to just, it's a patient pulling effect. Now, basic important for any culture lab is air quality. Now, suppose if somebody blindfolds us and takes us to a hospital or a doctor's room, from the smell we can make out, no, you're entered into hospital, the sodium hypochlorite fumes, etc., etc. तो पता चलता है कि कहाँ लेके आया पे मेरे को, you know. This is why, because the air in a lab or a hospital is more polluted than the outside air because it is saturated with organic compounds. Chloroform, correct? Phenyl, cleaning agents, styrene, plastics, anesthetic gases. And the environment in the labs is cool. So this is what we call it as the saturation potential of gas. If it was hot and open, they would have dissipated. But here in a lab, they accumulate. And when they accumulate, the toxicity potential increases. So air is the biggest parameter. So the HVAC system, or what we call it as heating, ventilation, air conditioning, has to be monitored regularly. This is all as per the pharma standards. So either we have a AHU air handling unit or just a positive pressure. Now positive pressure is what? Now many times we must have gone to malls. And in a mall during festivity season, we see the footfalls are 20 times more, 100 times more, because people shop as if the thing is available from tomorrow. And on the top of the roof, you must have seen pipes, multiple pipes. What are they? They are certain pipes which will pump in the fresh air. And there are some pipes which will be return air pressure, means they will take the impure air in front. So when the workload or when the footfalls are increasing, many a times we get a sort of a suffocation effect because the return is not working properly. There is carbon dioxide saturation in that room. So we get symptoms of hypercapnia or carbon dioxide saturation. The same thing happens in an embryology lab when you have a CO2 incubator. If there is no air quality filtering back, the carbon dioxide is 5% from an incubator compared to 0.3% in our normal air. So it gets saturated. So there has to be an input as well as there is an output. This is called as an air exchange. So in any good embryology lab, there has to be 10 exchanges per hour. It causes a complete rotation of the air. Okay? So this is how the air is classified. And these are the VOCs or the contaminants. And the next coming important is the temperature. What should be the temperature of a lab? Ideally, 24 to 26. Now imagine, we are culturing gametes. Ideal temperature 37. But to culture them, we have to keep the incubator in a room which is at 25. Any logic? Because our incubators and all, they are exothermic gadgets. They give out heat. So for their optimal functioning, the peripheral ambient temperature should be a few degrees less. That's the reason in hospitals we see X-ray rooms, sonography rooms, CT scan machines, supercomputers, all in cold AC rooms. Jis din AC band, us din machine band. Right? So this is the importance of your temperature also. Of course, in IUI, professional labs, they have maintained the temperature. Because in an IUI, you are using is a plain incubator. Plain incubator is not that much lethal as far as a CO2 incubator is concerned. Okay? So, this is the simple requirements for a simple semen analysis. Basics, nothing high tech. But good quality of disposables with good CE certification, proper expiry date, reputed brands, and your storage is very, very important. Store them in clean plastic bread boxes, big ones, document them, clear rooms away from sunlight, non-humid. Please check on their expiry date also. People argue, plastic make a expiry date. No, plastic may expiry date nahi. The expiry date will suggest that the way they were disinfected, that will wear off. Now many times we find expiry date on water bottles. Not that the water is going to be toxic, but the plastic will start leaching its toxicity into the water beyond that expiry date. So sometimes when you buy a cheap water bottle and drink water for 2-3 days, you get the plastic taste. But when you used to buy the Tupperware, excellent high-grade food quality, there was no taste. So that's the difference between plastics. Because all plastics are VOCs and COCs, remember that. So these are the basic gadgets for your IUI. Now, why we say laminar airflow? People always say IUI sperm preparation mein kya laminar flow? You are handling a sample, you are washing it, you are filtering it, you are layering it, you are manipulating it, and you are transferring it into an otherwise sterile uterus. So any impurity which enters the uterine cavity through the contaminated sample. So if you have done an IUI, patient within 5 to 6 hours complains of severe lower pelvic compaction or pain, something was wrong with your sample. Remember that. Because if the contamination increases in the CFU units, so the colony forming bacterial units increase, they will first block the tubes. So you have made otherwise a fertile patient infertile, so अपना IUI patient को अपना IVF में convert कर लिया. Correct? Plus, for your safety also, for the sample safety, because there can be airborne contaminants, there can be in-house sample contaminants, or there can be contaminants coming from your media, if your media is not equilibrated properly or cultured properly. Okay? So these are very important points. Hot block or dry bath? Dry bath or the hot block, you just incubate your tubes. Please see that the display temperature and the calibration temperature is quite the same. Centrifuge, as I told you, RPMs versus G-force. 300 G, ideal, 1200 to 1300 RPM for 10 to 15 minutes. Plain incubator for HIPPIS-based media, bicarbonate for CO2. Counting chambers and accessories, and most important, refrigeration to store the media, which should also be connected to a UPS. Now in labs, UPS is very important along with a built-in stabilizer, because we are not bothered about the power shortage, we are bothered about the power surge. Now when a power surge takes place, it messes up your delicate equipments, mostly your sonography machine. That's why they have that small battery backup, just like an umbilical cord always following the machine. Then, in your incubators, probes, carbon dioxide sensors, thermal sensor, delicate bulbs of your microscopes, inverted microscope, stereo zoom microscope, they will be messed up first, and they are very, very costly. So, when you are setting up a lab and investing into an inverter, sine wave continuous inverter, so there is no breakage. Check the wattage and the voltage of all your equipments. Buy this with a built-in stabilizer. That's very, very important. Fine? So this is the reason why I'm telling you why an LAF. And this is the important. Now LAF में क्या होता है? Laminar airflow, HEPA filters, high efficiency particulate air, porosity 2 filters, 5 microns, main HEPA filter, sorry, pre-HEPA filter and 0.3. Now every gadget in ART, it mimics our body system. People say, of course, 0.3 is for embryology filters. Smaller than that, we call alpha filters, where the high air class is 0. Now they are in prosthetics unit, chip manufacturing unit, medicine ointments, but here our air quality in the lab should be class 1000, in the incubator it is class 100. Main porosity 0.3, because our nasal mucosa is capable of filtering particulate matter till 0.3 microns. If they're smaller than 0.3, we get rhinitis. Correct? So all these body systems are mimicking in our gadgetry. That's very important. So what does an LAF do? please, we buy an equipment, that doesn't mean it is going to give you service forever. Service them, calibrate them, change some parts, like in HEPA filter, you have to wash the filter, you have to check for the integrity and UOP testing, because otherwise it will keep on making noise. You are thinking, kya powerful machine hai, before you realize that the bearings are worn off, and it is giving a very humming noise. So these are your laminar flow cabinets. A little integrated one and a little portable one, depending upon your space constraint. Air quality can be eliminated by the use of these filters. Now, remember, HEPA filters will remove only SPM. VOCs will be removed by activated charcoal and potassium permanganate. This is done so by the phenomena called adsorbing, just like in our AquaGuard. What we have? We have a candle, we have the charcoal, and we have a UV lamp. Charcoal deodorizes the water, the candle porosity, and the UV lamp. What does UV do? It doesn't kill the bacteria. It breaks the thymine of the DNA present in the bacterial cell and makes it incapable of subsequent procreation. So it chemically castrates it. So these things are all present in your LAF cabinet. Now in microscopy. Simple benchtop microscope. No need to buy initially a phase contrast, unless and until you are doing some high-tech sperm sensitivity specific test. But this objective should be the 10, 20, 40 and 100. Binocular, or if there is a third port over here, that's a trinocular, you can fit a camera and you can see on the screen, because today everybody wants to see, capture the images, or you do a workshop, you have to see everybody, ke dekho bhai aisa ho raha hai. It's like that. Sperm counting chamber, very important. Now this exactly when I'll show it to you. Mackler's chamber, Indian versions are also available. As I told you, advantage, mono layer of the sperm, prevents superimposition, ease in counting, but a costly gadget compared to our slide cover slip. So एक slide cover slip में खर्चा होता होगा ₹1.5, whereas this chamber is 65,000 only plus GST. Okay, and no spare parts are available. If the cover slip breaks, you have to buy the whole goddamn piece. So it was costly. So what we did, we Indians are smart. We copy everything. So we got our Indian version. They are equally costly, huh? They are not that cheap. Sensitivity, well, I can't comment on it. This was alternative to hemocytometers. Now this is important. Heat activation. Any gamete perfectly activated at 37. So please post collection, equilibrate in a tube, round bottom, keep it in the hot block. It will accelerate survival, it will accelerate liquefaction, and it will prevent loss of motility. That's very, provided this Charlie itself is well calibrated. Like see, red and green. Green is the set temperature, red will be the functional temperature inside this. So please calibrate and validate your gadgets prior to use. Anodized steel blocks, they can be autoclaved. Now if it's an IVF lab, you have to make 3 pieces of this. One in andrology lab, one in embryology, and one in the pickup room, where the aspirate post pickup are incubated. Because if the OCCs which are aspirated are in a cold tube, the spindle will be deactivated and you will never get cleavage embryos post 2 cell, because the spindle is very sensitive, very thermolabile. Now in a sperm, high temperature will deactivate the mitochondria of the midpiece. So no energy, so the ciliary moment get compromised. So hypo and hypothermia are very bad. That's the reason, if a gentleman has fever, don't do a semen analysis for at least 2 weeks. That's very important. Centrifuge, as I told you, and always prefer the swing out rotor, not the stable rotor, because in a stable rotor, the pellet will be at the side. In a swing out rotor, the pellet will be at the bottom. Now if you are doing a double density discontinuous in a conical tube, always the pellet will be at the rock center. So this is just a detailed part, RPM versus G-force, what it is. Because once the sample is spinning, it is centrifugal force. Once it stops, it is centripetal force. Okay? Different types. This is the head knob, the buckets. Temperature control, simple Remy. Incubators, important, depends upon the type of media which we use. Hippies media, ideal for sperm wash. Salt saturated substrate with hippies as a buffer. Mimics your cervical mucus secretions. Whereas buffered media contains carbohydrates, protein, just like a Ringer's lactate, supports the proliferation of a fertilized gamete all the way from zygote to your blastocyst. Incubators, plain versus bicarbonate. Medias available. Simple sperm wash, one media. Density gradient, two gradients, and subsequently the sperm wash media. Because these two gradients are nothing else but the filters, one and the second. A flow pattern of the media which we use. Now let's say, pick up individual gamete, OCC, so just flushing media. On the table you scan and screen, flushing media. Once the sperm and the egg meet, zygote formation, zygote 2 cell, 4 cell, or in a single step from the zygote till the embryo. Single step, but an embryologist should know what to use, when to use, why to use, and where to use. Why single step? That was debated. Just like Cerelac formula 1 to 2, newborn to 4 months old. That was our grade 1 media. Then later on, Cerelac formula 2, बच्चे को ज़्यादा पोषण चाहिए. Fine. Then came the idea, अरे buffet system डालो, जो खाना होगा खा लेगा. So give a single step media. Let the embryo choose what it wants. Both are good. Okay? Now, CASA, computer assisted semen analysis. Once upon a time it was a brand name. अरे तेरे पास CASA नहीं है, तेरा लैब पोपट. ऐसा नहीं है. CASA is an equipment which was doing all the things, but it had to be pre-modulated by us. It has to select the sperm, not the other cells, and count it. Till today I don't trust this. I only trust CASA for the morphology because it gives an interpretation of at least 100 stained heads at a time. And morphology is very important. But it's a costly piece. Better you trust your human eye because embryology work is patient work. Time and embryology work don't go hand in hand. Always remember that. There should be no haste. Okay? Again, now all labs, even IUI labs, should be having what they call it as a cryo program. Freezing of husband's sperm as a backup, non-availability of a husband, but you cannot use your bank for commercial purpose. That is totally out now. Correct? वैसा नहीं sir, मेरा brother-in-law donate करेगा, वैसा नहीं. Please, don't, nothing like that. So this is very important. And believe me, whenever you are doing any procedure, on that day, a gentleman can go into temporary ED and your whole procedure can be messed up if you don't have a backup sample. Because if you have a backup sample, at least the gentleman would think at the back of his mind, even if I'm not able to produce, the backup sample is there. But the backup sample will be effective if and only if it is frozen properly and it is thawed properly and it is stored properly. Storage is equally important. So when given the option in cryo, freezing, storage and thawing, people say freezing is best, some say thawing is best, I say storage is best. I freeze properly, I don't store it, I don't maintain the level of nitrogen, gone. It's a one-way ticket, no recovery. So these are cryo cans, or what we call it as Devar's flask. BA means biological, TA means transport. The number denotes the capacity in liters. Now this is a vapor shipper. I want to transfer the embryos from here to Delhi. I can't take it in a train with a liquid nitrogen. Who's gonna top it? So there are certain, these are completely wool insulations. Soak them with nitrogen, keep the samples so they will be frozen in the vapors. But they have a shelf carry life. Within 24 hours you have to refill them, or 48 hours. So depending upon the distance, you have to take care of the gametes. So that's why many times, many sperm labs are there out of Bombay, in Gujarat and all. When people ask for it, they are sending in vapor shippers. Okay? Consumables, very important. This messes up your whole scenario. Because I tell you, people are supplying things left, right and center without any guarantee or without, just like they take in a single plastic rubber, बंद करके वहाँ सीलिंग मशीन आता है, उससे सील कर देते हैं, सर स्टरीलाइज्ड है. What sterilization category? What is the type of plastic? What is the reprotoxicity? Nobody knows it. यहाँ तक कि when you do an IUI, the catheter of the plastic of the catheter itself plays a very important part, especially even during an embryo transfer, because this actually comes in contact with the biological fluids. Okay? So please note, because these are all the chemical contamination from the disposables. So they should be non-pyrogenic and mouse embryo tested. These are all the waste, obnoxious compounds which have been obtained from cheap quality plastic disposables. So please, select them properly when it comes to disposables. Simple disposables in your IUI procedure. Nothing much, nothing less. Just a photo of them. And these are all the guidelines. FDA approved guidelines, and here we are, because we are producing our life. If by chance there is some epigenetic trauma or gene related trauma, it will show not in the next generation. It can skip 2 generations and show. You got my point? So therefore, till today, when ICSI is done, we are still not sure any cellular mutation can take place even next year or next to next year. Even in vitrification, when we are using this super high concentration of propanediol, what effect is going to take? Because I had talked to many people also, they say maybe after 2-3 generations, then the shamelessly say, हम लोग तो नहीं रहेंगे वो time पे. So maybe the next to next generations will be the X-Men which we see in sci-fi movies, something of that sort. Cleaning solutions, equally important. No phenol, no Lysol, no aroma. So organic compounds are a big no. See, usually IVF is willpower versus willpower, right? You have bills you can spend, but spend reasonably. Best is those which contain silver. Because silver, what does it do? It denatures the bacterial DNA. We used to get the Adna Lifebuoy with silver, correct? So silver is now most potent as far as antibacterial agent is concerned. This is how we scrub. So the contact time is comparatively less. So this is how much the bacteria and the viruses get deactivated, and this is the contact time. Now this is in all labs, not only for embryology, this is in all the laboratories. So therefore QA/QC is important. Now that's the reason we don't know what went wrong in QA/QC in Wuhan in China, which spread COVID. Maybe the dish got open, the dish spilled, or the laminar flow did not work. What exactly happened? We are in a loss. And please, log your events. Whatever you do, you have to log it. Those labs which don't log their events, something hanky-panky is going on over there. Cleaning protocols, servicing of your gadgets, arriving of your disposables, expiry of your disposable, date of the procedure. Semen में क्या करोगे? Semen analysis, pre-wash, post-wash, cryopreserved, post-thaw, what is the comparison? So it is like a patient should have a complete detail, and now that goddamn records have to be stored for years together. Because it so happens you store, the patient doesn't come. तुम बोलोगे कल तो उसको मैं निकाल ही देने वाला हूँ सैंपल को. Next day the phone call comes, से मेरा एक सैंपल पड़ा है ना आपके पास, मैं आने वाला हूँ कल लेने के लिए. Because remember, storage charge, freezing charge and thawing charge. 3 things have to be taken into consideration also when you store your samples. Now some people don't pay but they come. Some people pay but they don't come. Some people don't pay and don't come. So the samples become like a museum in our canisters. Fine. So in spite of all this, don't think that the better the gadgetry, your results will tower. No. We need to have these 2 Charlies in an excellent condition. The egg and the sperm. It's only then what we will be doing is, we will be optimizing their subsequent result. Fine? So fine. Thank you very much.